talk a little bit about the nursing home world in the midst of COVID-19 and why nursing homes become, places that we really have to see as being more high risk for COVID. Why is that, Dr. C?
Well, there are three main reasons. The first reason is most people who are reside in a nursing or long-term health facility, they're over the age of 60, which characterizes you as high risk. The second reason is these are places where you're living within confined spaces. You may have roommates and you have workers going from room to room taking care of different patients or residents. And the third reason is this age population generally has more medical problems such as diabetes. They may have heart disease or lung disease, which also makes them high risk. So these three reasons together constitute reasons why nursing home patients or long-term health patients may be at higher risk.
So when it comes to the risk and the worst case scenario, which would be death, is there any connection between that risk and the deaths that we see in nursing homes?
Unfortunately, there is. COVID patients that live in nursing home make about 10% of our patients that we see with COVID-19. And then unfortunately, up to 45% of our COVID-19 deaths we can relate to being also residents at these long-term health facilities. And we're not just talking about the residents, we're talking about the workers, the employees who are also exposed to these patients or these residents as they're taking care of them also potentially have a risk and potential death exposures.
And so what are the ways that we protect both the patient and the caregiver?
Most of these facilities are, they have dedicated spaces or units for positive patients where they can get them out of the normal circulation of the other residents. They're also following the guidelines of the CDC to prevent, making sure they're having PPEs for their employees as well as the patients or the residents there. And also, if there's a roommate situation, they're having to take the positive patient from that room and making sure that that roommate is also monitored, if not tested. And this is where we really need adequate and broad testing so that we can test not only the symptomatic patients, but also the asymptomatic ones who have been exposed so that we can potentially cut down on further, positive cases.
And we've heard a lot about how things have changed, right? People can't go visit their relatives like they used to at the nursing homes.
And this causes a lot of people a lot of heartache. The times that you visit may be restricted, the number of visitors may be reduced, and also where you visit may be reduced. It may be such that you're doing outside activities, even distancing while you're doing that. But this is where we rely on video conferencing, we rely on telephone calls and other creative ways to visit. If you're sick, if you feel ill, if you've been around someone who's been positive, you're having fever, this is not the time to go visit. You really want to stay away because it has broader implications at these facilities where the spaces are so confining already.
And then when it comes to trying to find recommendations for caring for these patients, people who have memory impairments, for example, there's so many folks that we find in some of the nursing home environments, assisted living, whatever, that are facing that. How complex is this COVID-19 with memory problems?
Well, we have to recognize that if there's any changes in behavior, whether that be all of a sudden sadness, whether that be more agitation, or even just more confusion, it may not be worse than dementia. It could be signs of infection, certainly COVID-19 infection, and that's what we have to be very particular about in this patient or in this resident population. But routine is key. Patients with dementia or memory or cognitive impairment, they need routine. So, whether it's just the routine behavior of washing hands or routine behavior of who their caregivers are in the facilities, that's very important. The use of masks is a little bit questionable, especially if there's any incapacitation or any ability to be unable to remove a mask that's been worn. You may not want to be putting a mask on those particular residents, but certainly considering all the other things, considering outside walks, outside things where you can space out and just keeping that routine the same, especially in these dementia patients.
Dr. Cedrek McFadden, thank you.
Thank you.
And today we want to give a little special shout out to Dr. C because there's this thing called Room Rater. It's on Twitter, and they look at all the backgrounds of people doing interviews around the country or anchors that are anchoring from home, and they rate how you did. Dr. C, Ben, got a 9 out of 10.
That's pretty good.
That is.
Look at that. I wonder what the one thing was that prevented him from getting the 10 out of 10 there. I think it's a 10 out of 10. Maybe the books could be a little bit more upright. I don't know.
I don't know. I think it's a pretty great backdrop, and we certainly appreciate his expertise at all times here on 7 News, keeping us in the know as we follow big medical stories.
No, I'm serious. 9 out of 10, though. I mean, that's pretty good because I've seen some of them that are just ruthless.
Yes.
On some people.
Yes.
Good job, Dr. C.
Making riding a bike possible for someone with limited mobility. We'll tell you how you can.